So far, I would say that we did very well to keep our state case free. We don't have any case yet of coronavirus, and we would like to keep it that way. However, it will be highly unlikely because it's spreading worldwide. More than 60 countries have it, more than 90,000 cases in the world, about 3,000 people died. However, what we're doing, we have a goal, is to delay it and slow the spread, because we saw really that it's worldwide and it's spreading in our neighboring states, like in Washington, also spreading on the East Coast and in New York. So what we're doing is immediate identification of cases. So when we have a case, we test the case immediately, we isolate the case, and we identify contacts. Contacts are quarantined for up to 14 days. So far, we did that for hundreds of people who were evaluated, and we hope to be able to continue to do that. Yet again, it will be difficult. When the virus is spreading, you will have more cases, you will have more contacts, and we need to be able to keep up with that. The other thing which we're doing is we are partnering with the local health departments, with the healthcare providers. And remember, healthcare providers are the first line. So we want them to be safe and protected. So we disseminated a lot of information to healthcare providers, what to do in order to protect themselves. Because if they cannot protect themselves, we need somebody to take care of cases when we will have those. So it's a question of not if we will have cases, it's when we will have cases. The later, the better. Hopefully we'll be able to be very successful and we will have no cases whatsoever. So we prepared our state labs, and they have a capacity for up to 400 tests. We will get more. When you see what's happening in other countries, you really need to be prepared. We want our community to be prepared. We don't want them to panic, because it will happen, and we want everybody to know that whatever can be done is being done. And I want the people to be assured that they can reach someone 24/7. And one more thing, really, which is a more positive note. Just I was looking on the Johns Hopkins statistics. It seems that worldwide, more people are getting cured. About 40% of the people who got the disease, they cured on themselves, which tells me that the virus is not that severe. Yet again, we know really that about 2 to 3% of the people who got it died.
Is that number comparable to like cases of the flu? Like typically every year do we see 2 to 3% of people dying from the flu? Like what would you compare it to, I guess, in terms of what we know about the virus so far?
I would say this epidemic is easier than what we saw in 2002 when we had the SARS, which killed 10 out of each 100 people who got it. It's easier than the MERS, which is the Middle Eastern Respiratory Syndrome, which is still circulating in the Arabian Peninsula, which kills 1 out of 3 people who got it. This virus kills around 2%. It's significantly more than the flu. However, we really don't know, because 80% of the cases are very mild. So they may not be counted when you calculate this, what is called the case fatality, which is the numbers of the people who die out of the number of the people who develop the disease. We don't really know. The mild cases were not counted. So I would expect that the 2% could be higher than expectation. Yet you cannot calculate the final percentage except at the end of an epidemic, when this epidemic will be over, hopefully soon. And that's the time when we know what is the case fatality.
My last question, I just want to clarify, I know you have to get up on stage soon. Can you just clarify for me how, like, if somebody goes to a local hospital, they are showing some possible symptoms of the coronavirus, are the hospitals testing and then they send it to a lab? Because you mentioned the number 400. Can you just clarify, like, I know the CDC is like regulating the testing kits, and it's just a little confusing right now how people are actually able to test.
Yeah, I want to clarify, we didn't test yet 400. We do have the capacity to test 400. And another thing, I would say that if a person has symptoms, we don't want them to go to the doctor immediately. We want them to call the doctor. And that is based on CDC recommendation. And to prepare the providers that I probably was in China, I'm exhibiting some symptoms. We want them, because we want the providers to be aware that we do have a person who is at high risk of having the disease. And we want the providers, and also the patient is always welcome to call us. We want the local health department and the state health department to be aware that a person with high risk is probably showing up at the hospital. So the hospital will be prepared, because we want suspect cases, even if we don't know if they have the disease or not. Just if a person has severe respiratory syndrome, which is mostly fever, cough, and respiratory distress or difficulty breathing, we want them to be isolated. We want the providers to be able to have all the protection they can have so they would not contract the disease. So we will get the sample, and the sample could be collected by the providers or by the health department, and we can test it in Nevada in two places. One is Southern Nevada Health District Lab, or in Reno, the State Public Health Lab. And they take really very short time, in no time, because we don't want the people isolated for no reason. If they will test negative, because certainly other diseases, as you said, the flu is still happening. Some people have severe flu symptoms, which mimic the symptoms of coronavirus. Pneumonia, which is mostly caused by the coronavirus, could be caused by streptococcus, which is a bacteria, and it's still happening. We have other viruses which are causing pneumonia. Not every respiratory symptom means that I do have the coronavirus. It could be something else. So we want to rule it out immediately. And certainly if we confirm a case, we want that case to be isolated for the duration of the disease, which is up to 14 days. And we want their contacts to be accounted for. And we do have people working at the local health department 24/7 and at the state health department to identify all contacts. Yet remember, there are cases in Washington where we don't know how they contracted. And this is what is concerning, which means that it's called community circulating, which means that probably is spreading in the community. And when it starts to spread in the community, it will be very difficult to account for all cases and all contacts. Yet remember, really, the fact is that a case which is spreading in the community most probably is asymptomatic, because if you don't know you have it, your symptoms are very, very mild. And many of the young people, because most of the people who get severe cases are older than 50, so these are going to be very difficult to find. So we are doing the sentinel testing also, where anybody who has severe respiratory infection, we are testing them, even if they were not in China, even if they were in Korea or Italy. So we are just trying to see what is the level of community spread. And I would really say again that nothing which could be done is not being done. And I want to thank our local health department. They're doing a great job, especially the one in the south where we have hundreds of people which they had to monitor. And again, thanks heaven, there was no positive case, but it's a question of time. No confirmed coronavirus case yet.
So I just want to confirm.
In our state.
Yeah, so Southern Nevada Health District has already not tested, but they are monitoring hundreds of people.
And they tested many people.
Yes.
I don't really know the number because, again, we have the test, and we are encouraging providers to test. If your patient never was anywhere in any area where the coronavirus is spreading, if you think that you need to test them, please contact the local or the state or both, because we don't know, because cases in Washington had no history of visiting any country or coming in contact with anybody from the countries which are having community spread. So we want to slow it. Our goal is to slow it until such time where a vaccine, effective vaccine and effective treatment will be available. And that may be a year in future, but still we can slow it. I have no doubt that if we cannot prevent it, we can slow it.
Thank you, doctor.
Thank you.
Is it a swab test, the test that they use?
We are using the nasopharyngeal swab, but again, the virus is like we saw it detected in the urine, in the stool, yet we don't really know how infectious are that virus. But the one from the respiratory tract or nasopharyngeal most probably is a confirmatory test for the disease.